The governor announcement, meanwhile, on the antibody test treatments being expanded and highlighting the treatment that got emergency approval last November. A local doctor says it can cut the risk of hospitalization and death by about 70% if given early enough after positivity testing. Our Lauren Coomer joining us now live after speaking with him today. Lauren.
Yeah, Derek, over 5,600 Michiganders have already been treated with monoclonal antibodies, which are copies of antibodies or immune system proteins that seek out the virus. The therapy works best within the first few days of testing positive for COVID-19.
It's one of these times where we're really underutilizing a therapy. We have this is a time in the pandemic, one of the first times in the pandemic where we really have a resource that is not in short supply that could easily be used.
Monoclonal antibodies have only been around since mid-November. Dr. William Fales with WMed says it's synthetically made by drug manufacturers, intended to target the spike protein of the coronavirus.
It neutralizes the virus and helps to prevent reproduction of the virus.
Over 5,600 Michiganders took this treatment days after testing positive for COVID-19. But not just anybody qualifies.
It's intended for patients that have mild to moderate symptoms, but most importantly for patients that have high risk factors for disease progression to hospitalization or even death.
Those risk factors including things like being over the age of 65 or having underlying conditions like respiratory illness and heart disease. The monoclonal antibody treatment reducing hospitalization and death for patients by around 70% compared to those who don't get it. And it's given by IV.
The infusion can be given in just over 20 minutes, and sometimes a little bit longer, but generally just over 20 minutes. And then there's a 1-hour observation period afterwards.
Currently, 2 companies, Lilly and Regeneron, manufacture the antibodies. The therapy is free, the cost covered by the federal government through Operation Warp Speed.
When this first came out, it was a novel therapy. It was only authorized and continues to only be authorized by the FDA versus approved. So it's a new therapy, and doctors are understandably usually a little skeptical about brand new emerging therapies.
Dr. Fales says if you qualify by being high risk and test positive for COVID-19, he encourages you to ask your doctor about this therapy. For more information, you can head to our website, fox17newsonline.com, where we'll have a link to the federal government's page on monoclonal antibody therapy. Reporting live in Kalamazoo, Lauren Coomer, Fox 17 News.
All right, Lauren.